Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question is, what is the relationship between bipolar disorder and aggression? Now, to help answer this question about bipolar disorder and aggression, I'm using an article that was published in 2014 by Ballister and colleagues, and I'll put the reference to that article in the description for this video. So let's first start with the construct of bipolar disorder, and then we'll move to this relationship between bipolar disorder and aggression. So to understand bipolar disorder, it's first important to understand that there are two types of bipolar disorder, bipolar I and bipolar II disorders. Sometimes it can be difficult to differentiate between bipolar I disorder and bipolar II disorder, and that's mostly because of the way that mania presents, and that's the primary difference between these two disorders. So first looking at bipolar I disorder. Now bipolar I disorder requires that at some point there was a manic episode. Technically speaking, depression is not required for bipolar I, but oftentimes with bipolar I disorder, of course, we see major depressive episodes. So this disorder is conceptualized as manic episodes and major depressive episodes. Now with bipolar II disorder, we have here a hypomanic episode, and a major depressive episode is required. So without the manic or hypomanic components, usually what we would see with the symptoms with bipolar disorder would be major depressive disorder. So you could think of major depressive disorder as unipolar depression, and of course bipolar disorder has two poles. It's bipolar. It has the manic component and the depressive component. It's important to recognize here that sometimes we hear that bipolar II disorder is really a less severe variant of bipolar I disorder. And the evidence really doesn't support that. Both types of bipolar disorder are serious disorders that necessitate treatment. So now let's take a look specifically at mania, because again, that's really one of the central components here of bipolar disorder, and where it becomes, as I mentioned, difficult to distinguish one from the other. So with mania, we see 7 symptom criteria: grandiosity, a decreased need for sleep, being more talkative than usual, a flight of ideas or racing thoughts, distractibility, engaging in more goal-directed activities, and activities that are more likely to lead to painful consequences. Now with hypomania, we see the same 7 symptom criteria. So the way to distinguish mania from hypomania really isn't about the symptom criteria themselves, but rather some other criteria we have to look at. So in terms of distinguishing these two types of bipolar disorder, when we look at mania, we see that mania must last at least 1 week, and hypomania only 4 days. We also see with mania there has to be a marked impairment and possibly hospitalization and possibly psychosis. So usually when we think of mania and hypomania and we're trying to distinguish the two, hospitalization, psychosis would really stand out as mania. Now with hypomania, we see that the episode is not severe enough to qualify as marked impairment. There is no hospitalization and there is no psychosis. So really those 3 factors, marked impairment, hospitalization, psychosis, represent a cornerstone in terms of distinguishing mania from hypomania, and by extension bipolar I disorder from bipolar II disorder. It's also important to remember here that with bipolar I disorder, hypomanic episodes can still occur. It's also important to realize here that when a manic episode is in someone's history, that precludes a diagnosis of bipolar II disorder. So someone could have hypomania for 10 or 20 years and then have one manic episode, and they could never return to that bipolar II diagnosis. It's important to recognize the way this is worded. A manic episode precludes bipolar II disorder. A manic episode doesn't automatically mean bipolar I disorder, because another disorder like schizoaffective disorder could better explain the symptoms. A lot of times we think of schizoaffective disorder as really a combination of some of the symptoms of schizophrenia and some of the symptoms of bipolar disorder. Now the argument could be made that in this discussion of bipolar disorder and aggression, that we should mention cyclothymic disorder, because sometimes cyclothymic disorder is thought of as like a bipolar III disorder. But really when we look at the research with bipolar disorder and aggression, we don't really see cyclothymic disorder included, so it can't really be part of this discussion. Now there's another discussion that is occurring in terms of where cyclothymic disorder fits in. Again, it's outside the scope of this particular topic. So looking specifically at this relationship between bipolar disorder and aggression, we do see in the research literature that bipolar disorder has been linked to aggression. And if we look specifically at individuals with bipolar disorder who are inpatient, who are hospitalized, we see that they tend to demonstrate significantly more aggressive behavior than individuals that do not have bipolar disorder. We also see that in inpatient settings, physical assault is equally prevalent among bipolar disorder, schizophrenia, and substance use disorders. So this link between aggression and bipolar disorder is established, and it is a real problem in terms of treating the disorder and keeping clients safe. Now, when we talk about violence, that's a separate construct than aggression. That's not the same thing as aggression, although of course there is going to be some overlap between aggression and violence. When we think of violence that has been associated with bipolar disorder, that's actually largely explained by comorbid substance use disorders. So the substance use component of that comorbid presentation is really what accounts for the violent component. So sometimes we hear this myth that individuals with bipolar disorder are more prone to violence. That's not really the case, and I'll talk about that more in a few moments. So other findings we see in the research in terms of bipolar disorder and aggression is we see increased levels of anger and aggression during acute and psychotic episodes. So there may be certain times in the course of bipolar disorder where there's a greater risk of aggression. We also see that anger attacks are twice as common for individuals with bipolar disorder than individuals with major depressive disorder. So as we compare bipolar to unipolar, we see a difference there in terms of anger. So this particular study looked at bipolar disorder over the course of 4 years. This makes it a bit unusual among research studies, as usually it's just one point in time that's being looked at. So this was interesting in the respect that it's more longitudinal. In this study, they divided individuals into certain groups: individuals with bipolar disorder, individuals who had mental disorders, but none of them were bipolar disorder. And we also see what they refer to as healthy controls. These are individuals that do not have any mental disorder. So what were the results from this study? We see here that bipolar disorder was persistently associated with higher levels of aggression, more so than what we saw in the non-bipolar mental disorder group and the healthy control group. We also see here that after adjusting for confounding clinical factors, there was no difference between the non-bipolar disorder group and the healthy controls. We also see here that there was no difference in aggression based on polarity, so that means mania versus depression, based on type, that means bipolar I disorder compared to bipolar II disorder, and interestingly, there was no difference in aggression based on severity. So this, of course, would be a bit of a surprise, as we would think more severe presentations of bipolar disorder would have a stronger association to aggression. So I mentioned before that the relationship between bipolar disorder and aggression is different than the relationship between bipolar disorder and violence. And again, the substance use component, the comorbid substance use, largely explains any link between bipolar disorder and violence. And in this study, they specifically mentioned how these results, this link between bipolar disorder and aggression, does not mean that individuals with bipolar disorder have a tendency to engage in more severe violent behaviors. For example, homicide or using weapons in some type of assault. The aggression questionnaire that was used in this study didn't measure severe violent behaviors. Rather, it measured hostility, verbal and physical aggression, irritability, and indirect aggression. So those are different constructs than this construct of severe violent behavior. So really, this particular study linking bipolar disorder and aggression shouldn't be taken to mean that there's a strong relationship between bipolar disorder and violence. Still, even if we understand the relationship between bipolar disorder and violence and how comorbid substance use fits in, the link between bipolar disorder and aggression is important to understand. It can inform treatment, and it lets us know that treatment goals around anger and aggression may be something that should be considered for some individuals with bipolar disorder. I hope you found this description of bipolar disorder and aggression to be interesting. Thanks for watching.